Okay, so the doctor ordered a sterile saline irrigation of the wound, a wet to moist dressing change. So I'm going to do a pre-assessment before I do the wound change. So I'm going to wash my hands. Hello, I'm Coral. I'm your student nurse today. Can I get your name and date of birth? Okay, it matches. My hand sanitize. And I'm going to close the door for some privacy. And then the doctor ordered a wound dressing change. But before we do that, are you in any pain? No? If she was in any pain, I'd give her a pain medication, and then I'll come 30 minutes later and do the dressing change, but she's not in pain. I'm just gonna check your vitals. So I'm gonna check your pulse. Okay, 76, that's good. And I'm gonna take your temperature. Okay, and 98.6. So your vitals look good. So what we're gonna do with your wound dressing change is I'll take the old pad off, we'll irrigate it, we'll pack it, and then put a clean pad over it. Do you have any questions with that? Okay, I'll go get the supplies and I'll be right back. So, hand sanitize, and I'll go grab my supplies. So I'll wash my hands again, grab my supplies. Okay, I'm back with the supplies. And can you tell me your name and date of birth again? Okay, it matches. Hand sanitize. I'm just going to close the door for privacy. I'm just going to get my working station ready. Then I always want to make sure that it's above my waist. And then where it's a sterile technique, I want to make sure I'm not talking over the wound. I'm gonna use a non-adhesive. So I will look at the pad and I'll look if there's any discharge. There's a little bit. I'll look if it's thick or thin. It's just thin. But if this was dripping, I'd put it in a biohazard bag. But it's not, so I could just throw it in the trash. I will look at the wound. It's beefy red, so that's good. I'll look around the wound to make sure there's no maceration and the skin looks intact. So I will take these gloves off. Take my watch off, since it's a sterile technique. Hand sanitize. And then I'll just get my table ready. So I will put it away from my body. And then I have a 1-inch border. And anything hanging off the table is not sterile. Put the gloves on. And I'll get all my supplies ready. I don't need the bio bag, so I could just throw that away. So now I will irrigate it. So I'll grab one of these. With my left hand, I will grab the saline. And I'll use this just to catch any saline. Okay, good. I'll throw that away. So this hand is not sterile anymore. And after that, I will look at the wound, make sure it doesn't have any jagged edges or odor, and it doesn't. It looks pretty good. So now I will pack or check the depth or for tunneling. Looks pretty good. I'll throw that away. So now I'm going to measure. So I'll check the depth. It's about 4 centimeters. And then I'll check the width at the widest part. That's about 4 centimeters too. And then the length. That is about 5 centimeters. So my hands are not sterile anymore, so I can just throw saline on this. Take my gloves off. Hand sanitize. And then I will get these other gloves on. Okay, so now I'm gonna pack the wound. And then when I pack it, I wanna make sure I don't touch the skin around it. Or I don't wanna pack it too tight, because I don't wanna stop the circulation, blood circulation. So now I'm going to clean around the area. So go down the side, up, go down this side, up. Now I'm going to dry it. Side. The other side. Drop it. Okay, so now I'm going to skin prep the skin. Then I'm going to put the ABD pad over it. And I try to make sure I keep my hands on the top of the ABD pad. And then I'll tape it. I'll tape this side and this side. Okay, so now I will clean my area. Okay, Sally, so with with the ABD pad, just make sure that you don't shower. Just make sure it's clean and just don't take it off. Do you have any questions with that? Okay, so here, cover you up. Hand sanitize. Okay, well, here's your call light. Here's your table. I'm gonna lower the bed and just kind of clean her area. Okay, do you want me to leave the door open or closed on my way out? Okay, I'll leave it open. Okay.